and Research Center, our today's chief guest, Elizabeth Ferber ma'am, Dr. Giridhar Vedantam sir, Principal of Guru Gorakhnath Institute of Medical Sciences, Gorakhpur, to please come forward and start the event by offering Pushpanjali. I'd like to request our respected dignitaries to please start the event by offering Pushpanjali.
Tell everybody to switch off or silent their phone.
Please switch off or silent your phones.
या कुंदेन्दु तुषार हार धवला या शुभ्रवस्त्रावृता या वीणावरदण्ड मण्डित करा या श्वेत पद्मासना या ब्रह्माच्युत शंकर प्रभृतिभिः देवै सदा वन्दिता श्यामां पातु सरस्वती भगवती निशेषजाड्यापहा निशेषजाड्यापहा.
Now I'd like to request everyone to please stand up for Dhanvantari Vandana.
नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुग्भयमृत्युनाशं धातारमीशं विविधौषधीनां चम्यो ममाता मणिवारिमहिनी पंच प्रपंचात्मक देह भाजम संपात जरास्वरांकम नमामि धन्वन्तरिमादिदेवं नवीन नीला मुदितातिकान्तं शान्तं हरेवादशमाख्यमूर्तिं पूर्तिं शतानामि सुमिनोर्यतानां नमामि धन्वन्तरिमादिदेवम्.
Thank you everyone. Please be seated. Now I'd like to request our respected Dr. Giridhar Vedantam sir, Principal of Guru Gorakhnath Institute of Medical Sciences, Gorakhpur, to please come forward and deliver the welcome speech.
Respected Principal Dr. Anurag Srivastava sir, and who is the chairperson of today's event, and Miss Elizabeth Ferber ma'am, who is the president and founder of Ferber Healthcare Consultants, who has been our chief guest and resource person for our guest lecture today. So I welcome both of you from our MAHAYOGI Gorakhnath University as well as our Guru Gorakhnath Institute of Medical Sciences. Yes, thank you. So today we have assembled here to have the vision of Miss Elizabeth ma'am. So we can, because of vast experience she is having, we will be knowing how in the public health care, what are the perspectives, and today we have a occasion because this occasion is also similar. NSS, National Service Scheme. So these 7 days you have gone to villages, you have visited house to house, and you have done house to house survey also on some health perspectives and what are the views of people on our Ayurveda or something. And you have had medical camps there and also some campaigns on de-addiction as well as the women health care. So you are doing some sports and cultural meets. Today we will have a feast of intelligence on public health from ma'am. I welcome ma'am for this, and I welcome all the faculty members, dear students for this, and thank you for giving me opportunity.
Ladies and gentlemen, it is our Ladies and gentlemen, it is our distinct pleasure to introduce a renowned expert in the healthcare industry present among us today, Miss Elizabeth Ferber. Now I'd like to request our respected principal sir to honor our chief guest with a very deserved memento of honor. I'd like to give a brief intro about ma'am. She is holder of MPH, MEd, founder and president of Ferber Healthcare Consultants. With an impressive career spanning over 20 years, ma'am has developed a profound understanding of intricacies of the US healthcare system. From community grassroots efforts to hospital administration, and from corporate-wide strategic project management to healthcare consulting, her expertise is unparalleled. Her passion for improving healthcare outcomes and addressing the social determinants of health has driven her to become a trusted advisor to corporates, educational systems, and health ministries. Today, ma'am will share her valuable insights on addressing the complex factors that influence individual and community health. So please join me in welcoming Miss Elizabeth Ferber, a true thought leader in the healthcare industry.
Thank you very much. Thank you. Good morning. Hello, everybody. I want to say first, I'm very honored to be here. Thank you so much for taking the time today. I know you're all very busy with your studies, and it's a great honor to be here at the college. I've been in India now 2 weeks, giving presentations and touring health systems, and I'm very, very, very impressed with all of the work that I see from the south to the north and in Bangalore. So I just want to thank you for all your efforts. Going into healthcare is a very important field to enter, and it's not one that people can take lightly. It takes a lot of work and dedication, caring for patients and for communities. So I just want to thank you very much for that. And yes, namaste. Okay, so before we start, I want to thank the young woman who gave me that amazing introduction. And I have worked in healthcare, as she said, for many years, and most recently for a large health system in California called Kaiser Permanente, where I did a lot of work in community and government and project management, and finished my career there working on social determinants of health and how to build a program of community information exchange in order to provide better care for the patients. I want to say that today, with this program and presentation, that it's just the beginning of a conversation. The interesting thing about this work is that every system and every provider and the relationship they have with the patient can be individual, and they can tailor it to their own needs. It's not a one size fits all. So today I'm just opening the door to a conversation that I hope you will continue to have with your colleagues, your faculty, and your patients. Okay, and without further ado, we will go. And if people have questions at the end, will we take questions? I think that makes sense. Okay, so hold your questions. All right. So I'm just going to go over the agenda first. And maybe I'll take this off just for a minute so I can turn. We are going to define the social determinants of health as defined by the World Health Organization. All of you have a handout that I created, and the first thing at the top is the WHO definition of social determinants of health. And I think it's a very good one, a comprehensive one. Other people and institutions who do this work sometimes have different interpretations, but I think the WHO definition is a good one. Today, I'm going to talk about a topic, not just social determinants of health, but commercial determinants of health, which relates to industries and businesses and how those affect the health of individuals and communities. We're going to look at some social determinants of health frameworks. Oh, thank you. All right. Okay. Hello, hello. Okay. Now we're untethered. Yeah. Do you want to take this one? Okay. I think that's probably easier. Okay. Thank you. Little technical change there. So on the back of your handout, there are two examples of social determinants of health framework, and we will look at those on the slides and go through them. The one that I think they're both good in how they show different ways of looking at this work. The next thing we'll do is look at the consequences of social determinants of health, a few research examples, and then we'll just have a brief foray into commercial determinants of health and look at those definitions. And that's an area of work that's relatively new in some ways. And then, of course, the strategies to address social determinants of health that would help you with your patients when you are treating people, how you look at them when they come to you, not just their vital signs, their blood pressure, their blood work, but what their life is like. And that's really what social determinants of health are about. And then the benefits of addressing these social determinants of health for patients and communities. Okay, so as I said, here's the definition, a little bit longer, that WHO has decided is what defines this work, social determinants of health. And it's everything that is your life, basically. It's a very holistic approach to looking at a patient, because traditionally, and certainly in the United States healthcare system, patients come into a health system, an exam room, they meet with a nurse or a physician, and they have maybe 10 minutes, 15 minutes, and they go through how their, what their ailments are, they take their vital signs. But in many, many surveys and lots of research that has been asked of patients, they would really like their providers to know more about their life. How was it to come to this appointment? Do they have childcare? Do they have health insurance? Are they having financial or nutritional hardships and needs? So these are things that patients want their providers to know about because they do feel, and research has shown, that it has a great effect upon their health. All right, so here are just some examples of social determinants of health that can influence health in positive and negative ways. And some of you may be aware of some of this work. Some of the SDOH research and efforts has been done in India. So you can go to Google and look up and see some of the research that has been done. So for example, income and social protection, very important for people to have a sustainable and regular source of income in order to live. Their education, people with higher education tend to have better health outcomes. And all of you are seeking much higher education and will be very aware of how to navigate your way through a health system because of that education. Unemployment and job insecurity is definitely one of the SDOH that can negatively impact people. If you don't have a job or if your job is insecure, it not only can affect you, but all of your family and your community. Working life conditions, it's very important that where people work, and some of this comes into commercial determinants of health, is a safe place to work. It is an injury prone, and that's everything from a hospital to a restaurant, to a factory, to a boat. It's very important to have safe working conditions. Food insecurity, very big social determinant of health. We have something in the United States called food deserts. I don't think you have that term in India. But basically, it's communities where there's no access to healthy food. There are no gardens, there are no supermarkets with vegetables. The only access to food is unhealthy food, and those are called food deserts. And that's one area that people who address this work are looking to remedy. Housing, basic amenities, and the environment. Providing people ensure that their communities have safe places to live and that the air quality is good. And that they have running water and clean water. Early childhood development. We know from years and years of research that it's very important to address the developmental needs and realities of young children. They're not young adults, they're young children, their brains are still forming. And it's very important to address these early childhood development needs. Social inclusion and non-discrimination. One of the leading indicators of longevity in the United States, and I think globally, is engagement in a community and feeling that they're part of the living world still, and they've not been put aside. And that is very important in terms of social inclusion and, of course, non-discrimination, so that everyone has a chance for economic opportunity and a good life. Structural conflict, and these relate to all of the isms like racism, sexism, ensuring that these areas are addressed and overcome, and that organizations and health systems and communities are free of them. Access to affordable healthcare services of decent quality. This area, number 10, is one that's particularly interesting to me. How people access a health system, what are the barriers to that care once they're in the health system, ensuring they have high quality. One of the things that I have studied in my research in comparing health systems in India is seeing how the quality levels are at various places, hospitals, clinics, very high quality in India for the most part. It's really an area that everybody is addressing. Having electronic health records is very helpful with this. So access to healthcare is a very important social determinant of health. And one of the things that, can someone tell me what a barrier to healthcare might be? Can anyone raise their hand? No? How about transportation? If you can't get from your home to your hospital, that impedes your access. And let's say you have diabetes and you have to do regular appointments and you can't get there. Your diabetes gets worse. You end up in the hospital in much worse condition. Transportation is a very, very important aspect to someone's life. Okay, so now we're just going to look at a little comparison of social determinants of health versus commercial determinants of health. All right, as we've seen, the social determinants of health are the circumstances in which people are born, grow up, live, work, and age, and the systems that are put in place to deal with illness. Commercial determinants of health are the conditions, actions, and omissions by corporate actors that affect health. Commercial determinants arise in the context of the provision of goods or services for payment and include commercial activities as well as the environment in which commerce takes place. They can have beneficial or detrimental impacts on health. Now, for example, if you have a large factory near you and it's spewing pollutants into the air, that will have detrimental effects upon a very large community. And it's important that the people who own the industries address these commercial determinants of health. Another example is Coca-Cola. Coca-Cola in the United States, until recently, very aggressively commercially promoted themselves to young people, to teenagers, to children. Very unhealthy for young people to drink that much soda. It's important that the industry is responsible and not promote over all other beverages something like Coca-Cola. In Central America now, families and children and communities drink more soda than they do milk, water, and coffee. And the effects of that, for example, on what's a health illness that might be a result from drinking too much soda? Diabetes, yes. And diabetes is a lifelong issue for many people. So that's an example of a commercial determinant of health. All right, so this is one of the frameworks that I provided on the back of your sheet, as well as on the front. There's a chart that talks about the distal, individual, and proximal determinants of health. And I think this one's very good because it shows you the sort of larger forces involved in a general socioeconomic, cultural, environmental conditions that affect people's life. And those are things that most individuals don't have control over. And then there's sort of the social and community networks, there's schools where they practice their religion, where they work, and those they do have a certain degree of control over. And then there's the individual lifestyle factors, the ones that are closest to them, that you do have control over. How much exercise you do, how much sleep you get, what you eat. So these three different levels, and you'll see them, as I say, on the chart on the front of the handout, are a very good framework in which to kind of put this within a context. And then the next one that's on your sheet that I want to point out is from the Canadian Medical Association framework. And this is really, I think, a great visual because it shows you that most people think that what determines your health are your genetics, your biology, how much you go to the doctor. But really, and this is just one example of this, it's your life that really affects your health. And it's what we call upstream opportunities. So if we can take care of people in their communities, provide them with good housing, with food, with transportation, education, they won't come into a health system sick. And that's also very good for a health system because it puts less stress on the providers and it saves money. And that's a big thing that healthcare administrators always want to do. They always want to save money. And addressing these issues helps to do that. And this is research that is still ongoing. And it's very, there's a lot of data in this work, but it's data that changes a lot because people's lives change a lot, where they live, how much food they have. But it's very interesting to see how the data is being collected now. Okay, so how do social determinants of health contribute to health disparities and inequities, which is why we want to focus on them, because we want to help to equalize this playing field and help to remedy some of these disparities. For example, as we said, people who don't have access to healthy foods are less likely to have good nutrition, which raises their risk of many health conditions, including heart disease, diabetes, and obesity, which are all related to each other. So if you deal with one issue, you will be helping all of these, and even lowers life expectancy relative to people who do have access to healthy foods. And that is something very, what we call black and white. If you have access to healthy foods and you eat healthy food, you are much less likely to have these health conditions, which are really lifestyle chronic conditions, right? We had beginning of the 20th century and before bacterial infections, antibiotics came in, started to, understand more about public health. And now we're really dealing with these lifestyle diseases. And when one or more of these conditions poses challenges, such conditions can become risk factors for poor health outcomes. And I don't know if some of the work that you've been doing, I think you're very focused here in your studies on preventative care, and this is very much about prevention. One of the things, I now live in Europe, I have learned about public health in Europe is that a lot of their focus is on disease treatment and disease management. Whereas I really think prevention is a better way to start and to focus resources. Of course, we need disease treatment and disease management, but we'll have less pressure on that system if we address these. Okay, just promoting healthy choices won't eliminate these and other health disparities. Instead, public health organizations and their partners, because this work really needs to be done in partnership, healthcare providers can't do it alone. You have enough work to do already within your system. Their partners in sectors like education, transportation, and housing need to take action to improve the conditions in people's environments. So people have a certain amount of control over their environments, as we've seen from that chart that talks about individuals. But really, we need all the sectors that affect people, like the bus system, public transportation, food systems, schools, people who build houses. We all need to work in partnership to help address these social determinants of health. Okay, so research, this is just a little example of some research shows that social determinants of health can be more important than healthcare or lifestyle choices influencing health, as we've said. Numerous studies suggest that SDOH account for between 30 to 55% of health outcomes. It's pretty high. In addition, estimates show that the contribution of sectors outside health to population health outcome exceeds the contribution from the health sector. So that's saying that, as we've said, all of these areas outside of a health system have a greater impact on people's health than when they're in the health system. In fact, where I worked, it was our system was designed, we didn't want people coming into the health system, other than obviously for checkups and if they needed to come in preventative care, but we didn't want people in our hospital. We didn't want sick people. We wanted to keep people healthy. And I think there's been a big shift in some of the language around medical care, disease treatment, to really calling things health care and patient-centered care. One study estimated that on average, clinical care impacts only 20%, this is in the United States where everything's divided into counties, county-level variation in health outcomes in the United States, while SDOH affects as much as 50% of health outcomes. I think that's a really interesting percentage gap. Okay. All right, and just a quick look again at some of the commercial determinants of health. For example, you have a very big factory right across the lake from here, don't you? Yeah, and someone, you were telling me that the company that runs it is very good about making sure that environmental factors are put in place so it's not polluting the air or the water. And that's an example of somebody addressing a commercial determinant of health within the industry. So as we said, they are the private sector activities that affect people's health positively and negatively. And they have different business actions and societal engagements, for example, through supply chains, labor conditions, product design, and packaging. Trying very hard to develop packaging now that's not plastic-based, so that when people throw things away on the ground, they biodegrade and they don't photodegrade and affect the environment negatively. Research funding, very important that industry provides research. A number of the big pharmaceutical companies in the United States have large research branches. Very important to develop new vaccines for pandemics, for example, lobbying, preference shaping, and others. And here are just some of the health impacts, as we've said, that commercial determinants can also affect cardiovascular health, things like road traffic injuries, mental health, cancer. Commercial determinants of health affect everyone, but young people are especially at risk. And unhealthy commodities, like we discussed with the soda, worsen pre-existing economic, social, and racial inequities. Certain countries and regions, such as small island states and low and middle income countries, face greater pressure from multinational actors. There are effective public health actions to respond to these determinants, which are key to building back better after critical societal events such as COVID-19. I think COVID-19 was a very good opportunity to advance certain areas in these sectors of social and commercial determinants of health, as well as all of the medical and science sectors. All right, so some strategies for addressing social determinants of health. As we said, housing is a big one. Provide safe and stable housing for people. It seems pretty self-evident, but it's a very tricky thing where there's market factors involved. Make sure that the homes and the structures you're providing them are safe, floors, ceilings, that there are windows, that there's good ventilation. Healthy nutrition and food access. This is a huge area, and one that, as I said, in the United States is very big on the social determinants of health list, and one that within certain communities is at a critical point in providing healthy food to people. Transportation, this is what we talked about before. If people don't have transportation and they can't get to a health system, or they can't get to the place where they're buying healthy food, their health outcomes go down. The other thing that I've heard from certain health systems within India is that a lot of the care is delivered within a hospital. A hospital and a clinic are similar places, whereas in the United States, clinics and hospitals are separated, outpatient versus inpatient. One of the big hospital systems in the South that I toured is going to start to build clinics out in rural areas so that people don't have to go so far and worry about transportation to receive healthcare services. You're decentralizing the care, bringing it to people in the communities, as opposed to people having to travel long distances. Social and economic mobility. This is one that each country, each society has to see how people are able to rise on the economic ladder, including women, and giving them opportunities in education and healthcare and business. Social service and community connections, making sure there's good case management. If someone comes to you and you tell them to go access some service outside, either dentistry or optical or food or mental health, that somebody's managing that person and knows if they've actually gotten those services. And then community health workers. This is an area where people who are non-medical or healthcare professionals, but are trusted members of a community, whether it's an elder or a religious figure, has the trust of the community and can report on how the health is. Medical staff and health workers patient engagement, and that's all of you. And that's really coming together as teams and as healthcare providers to put the patient at the center of your care and figure out what are the best strategies to ensure that they have a good experience within your system. All right, and we're almost at the end. I realize you all probably want to get to lunch at some point. Benefits of addressing social determinants of health, if they're not self-evident. So for patients, increased engagement in self-care, and that's really important, that people in a lot of societies, and I think in India, the doctor is very high up and looked at as somebody with an enormous amount of information and power. But people, it's really important that they take care, they see themselves in that picture as well, of taking care of themselves. A greater understanding of how social determinants of health affects overall health and well-being, and becoming more health literate, so they understand about good nutrition, about clean water, safe working conditions, the benefits of fewer visits to a healthcare facility within a health system. Empower patients to educate themselves and family members regarding the social determinants of health. Enhanced communication between a patient and a medical provider. You really want your patients to be able to communicate to you effectively, and so you can provide them the best care that you can. And then awareness that the medical provider is interested in their total health, their life, and not just the symptoms of their disease. And that's what all that research has shown. And then to communities, I won't read through all of this, but it's very similar. Things like what we call structural public health, providing parks, bike lanes, good lighting outside so that people have safe places to exercise, to go to their markets, saving energy costs with efficient use of transportation services. If you can put a clinic into a community, people don't have to take buses and cars and motorcycles and use petrol and things. So there's all sorts of benefits to communities for this. And then in the private sector, again, improved relations with communities, reputation is much better, you're a trusted industry, potential workforce development opportunities for those considering healthcare careers, opportunity for industries to partner with educational institutions, influence government entities and health authorities to make changes for good. Companies are very, very powerful. They have a lot of money and a lot of influence. And if they can help government officials and health ministries do things that are good for communities and individuals, that's a wonderful thing. Okay, so now we're at the end, and I'm just going to give you a few little action steps that maybe somebody can take on and start to think about forming a committee and addressing some of this work. Patient surveys are very important. You may do patient surveys already in this work. Some health systems I've been to, as the patients are waiting, they give them a survey and they can fill it out. You know, was it difficult to get here today? How many fruits and vegetables do you eat a week? I have several examples of different organizations that have used surveys, which I can share with Dr. Kumar, and he can share with the group. And this is not just when the patient is face-to-face with you, that you're asking them these questions. There's a lot of opportunity as people are waiting, because people tend to wait a while before they see a provider, to fill out these surveys, and you can really capture really good, rich data and see trends. Community needs assessment. Teams going out into communities. Are the streets safe? Are the houses safe? Are there good schools nearby? Figuring out what in a community might need to be improved and developing those partnerships. This is something, the action step 3 that I had worked on just before I retired from Kaiser, which was a community information exchange between health partners and community organizations. So you see a patient and they tell you they're having trouble getting food. You suggest to them they go to this particular organization that provides food. And then that organization and you have a way to communicate with each other, either traditionally or electronically, so that when the patient comes back to see you, you know that they have gotten that food. So that's a big area that's growing right now. Structural public health assessment. Again, making sure that the places where people live, work, play, have transportation are healthy, are safe. Determine the barriers to implementing change. What is standing in the way of people getting healthy food, of having exercise? Why are childhood asthma rates so high? What is going on with the air quality? All of those things. What are those barriers that are holding people back? And not enabling change. And then convene stakeholders and set goals. And I would say this is wonderful work for leadership opportunity, for someone to form a committee, for the committee to meet, to look at some of this work, and then to take action. So that's where we will end. All right. Well, thank you very much. Here's my contact information if anyone has any questions. Okay. And now we have a little time for anybody have any questions or comments they'd like to make? Okay. All right. So you're all experts now, right? You can all go out and do social determinants of health. Okay. All right. Okay.
Wonderful presentation, ma'am. So if we wish to start a community activity around this locality, how should we begin?
Well, as I said, I think the first thing is to identify volunteers, people who want to come together in a small group and look at some of your local patient population and what are some of the social determinants of health that affect your patients the most. Is it transportation? Is it housing? Is it food, childcare? And start to come up with a plan. As I said, those action steps. Let me see if I can get back there. So actually, action step 6 is that really refers to convening a larger group of partnerships. I think before you do action step 1, develop a group of people who want to take some of this work on. And then, and it's very important to sort of test small before you scale. I think what we've seen with some projects is that administrators get very excited and they're like, let's just roll this out across the system. And the system's not ready to handle the work. So the first thing is to develop a plan and test it in a small way. Do you have community partners you work with when you do the camps, for example? Talk to them, see if they're community health workers, which population within their community is having the hardest time managing either a chronic illness, an infection, or children having issues. So it's kind of getting a group together and gathering information and making a plan. Okay, thank you. Good question. All right, thank you very much. Okay.
Thank you so much, ma'am, for such a remarkable and insightful session. We are very honored and graced with your presence today. Now I'd like to request Honorable Dr. Anurag Srivastava, sir, Principal of Sri Gorakhnath Medical College Hospital and Research Center, Gorakhpur, to deliver the presidential speech. Please, sir.
Honorable Madam Dr. Elizabeth Ferber, it's an eye-opening lecture that you presented and your lifetime work on identifying and working with the social determinants of health and then commercial determinants of health. They are really eye-opener for us. And thank you very much for delivering this guest lecture. And we'll work with identifying both these components, social and commercial determinants of health. They affect, the population across the globe, whether you're working in America or in India. And there are very strong reasons why people get sick. My father's elder brother lived for 100 years. Last year, he celebrated his 100 years in a centenary. So we went there to, congratulate him and then asked him, what's the secret of living for 100 years? Good health. So he mentioned a couple of yoga, and he used to do 2 hours of yoga every day, pranayama, and fasting. He said fasting. And so all these, do determine, but many of us, at least in the poor communities, the villagers, the farmers, the peasants, the um, daily wages workers in the farms and on the road, in the streets, do not get enough opportunity. They are either totally illiterate or they did not have the money to eat fresh fruits and vegetables. They are more expensive than eating just, high carbohydrate, cereal based diets. So they are real issues that we have to address. And Honorable Prime Minister of India, Shri Modi ji, and locally, Honorable Chief Minister of India, Chief Minister of Uttar Pradesh, Shri Yogi ji, who also is the Chancellor of this university, and are contributing immensely in these directions. So they have started a lively debate called investing in people. And I had the good opportunity to share the webinar day before yesterday with the Honorable Prime Minister. And he said there are three areas they are focusing: education, skill development of the people, and health, good health. And as you know, the United Nations has 17 the SDG, the Sustainable Development Goals, and the goal one, SDG 1, is poverty eradication. Number 2 is the nobody should have hunger eradication, and number 3 is good health and wellness for all, and preventing premature deaths. So if we address these three, I think we will win the battle against health. And Madam, I may tell you that like you, I also had opportunity to study public health in School of Public Health in North Carolina, Chapel Hill, under the Rockefeller Foundation program. And there we had address by the then Surgeon General, the first lady Surgeon General, Dr. Joycelyn Elder. You might know him. She was a public health person, I think. So she said that there are three enemies of health, 3 P's. So you should remember 3 P's: poverty, population, and pollution. So if we handle these 3 or take care of these 3, population, poverty, and pollution, I think we will again win the battle. So they are very difficult though, but we have to tackle these. With these 3 words, again, thank you, Madam, for your kind visit. And I hope that you have some time to see the places around and guide our team to take this opportunity further. Thank you. Thank you. And serve as a mentor for us. Thank you.
Thank you so much, sir, for your very poised words. Now I'd like to request Dr. Giridhar Vedantam, sir, to honor presence of Dr. Anurag Srivastava, sir, with a bouquet. NSS claps goes to our honorable dignitaries. Thank you, sir.
Can I just say?
Yes.
So, in many cities like in Bombay, you will find that they don't give bouquets, they give plants. So, pot with some plant, and in All India Institute of Ayurveda, they always make it a point to give a plant which has some health enhancing benefits. Like, the snake plant, oxygen plant, they call it, aloe vera, some anti-cancer herbs. So, I think we should change this pattern of giving bouquets to offering plants, especially some anti-cancer herb or some other health enhancing plant, right? Thank you. Tulsi, maybe Tulsi.
Thank you, sir. Now I'd like to request Dr. Vaishak R. Sir, Assistant Professor of Department of Swasthya Evam Yoga, to please come forward and offer vote of thanks.
Good afternoon, everyone. Good afternoon. Okay. The respected Principal Sir, Dr. Giridhar Vedantam Sir, and Chairperson Dr. Anurag Srivastava Sir, and our Chief Guest, Madam Elizabeth Ferber, and faculties and my dear students. Okay, on behalf of NSS and our university, it's my great honor to deliver the vote of thanks to everyone present here. Okay, I would like to extend our heartfelt gratitude to Ms. Elizabeth, Madam, Founder and President of Ferber Healthcare Consultants, for taking the time to share your invaluable and insights on topic of social determinants of health. Okay, she has shared our 20 plus years of her experience, and it was very eye-opening. Okay, your words have not only enlightened us but also encouraged us to strive for excellence in our own journeys. Okay, thank you once again, Madam, for your time, knowledge, and inspiring presence. We truly appreciate your contribution to making this session both insightful and impactful. Thank you so much. Wish you all success in your future endeavors. Thank you.